Hi, my name is Courtney, and today I will be performing a full liver scan with Duplex. So to start off the exam, we're going to put some gel on our probe. And we are going to start off by sweeping through the entire organ in both sagittal and transverse. So I'm going to get situated here. And we're just, like I said, just quickly going to sweep. So for our sweep, we're just going to make sure we have the correct window for this patient, and we're going to just get a quick look at her liver, things like echogenicity, contour, and whether it's heterohomogeneous. So we're going to start at midline subxiphoid. We're going to start in the sagittal plane, and we're going to first sweep through the left lobe of the liver. So we'll have our patient taking a deep breath. And during this time, we're just going to make some adjustments to some settings here. We're going to sweep all the way out. I'm going to adjust my focus here all the way out to the lateral left edge. We're going to sweep back through the right lobe, increase our depth, make sure everything's checking out okay. And we're going to sweep all the way through the right lobe, and we'll have our patient breathe. Then we are going to flip into the transverse plane, and we're going to do the same thing in both the left and right lobes of the liver. So we'll have our patient taking another deep breath. We'll just increase our gain just a little bit here, cut our depth. And so we're going to start far superior at the level of the hepatic veins, and then we're just going to come down, sweep out. We'll have our patient breathe. We'll flip over to the right lobe. We'll have our patient take in one more deep breath. And we're going to come all the way far superior. Make sure we're getting that nicely. And we're just going to keep coming down through the right lobe. We're going to make some adjustments here. And we're going to fan all the way out. We'll have our patient breathe. And then we're just going to quickly take a look at the liver kidney image, subcostal right rib cage. So we'll have our patient take in one more deep breath, and we're just going to flip through this area quickly, and that finishes our sweep up. So we'll have our patient take a breath, or breathe out rather, and then we're going to start at midline subxiphoid once again, and we're just going to take our still images of the right lobe in this, or the left lobe in the sagittal plane at this time. So we'll have our patient taking a deep breath. This time we just want to make sure all our settings are looking, or the liver is looking appropriate, adjusting some settings here. We're going to cut our depth. First picture is the caudate lobe with the left lobe in view. Ligamentum venosum is separating the two. We'll freeze it, have our patient breathe, and this should be changed to left. And then we're going to continue slicing through and taking our still images. So we'll have our patient taking another deep breath. And our next slice, we're going to see the aorta come into view. We're going to keep slicing through all the way to the left lateral edge here. We want to make sure that the parenchyma is still looking diagnostic. We don't want it to look too dark, because then we can't evaluate it properly. So we'll have our patient breathe, and then we are going to start again in midline, and we are going to evaluate the right lobe in the sagittal plane. So we'll have our patient taking a deep breath, and we're just going to flip through here. So we're going to start at the same image with the caudate lobe in view, except we're going to just tilt slightly farther right, and we're going to see the IVC come into view, and we're going to increase our depth. Next image is the made lumbar fissure, and we'll have our patient breathe quickly. We're getting a little bright here, so I'm just going to turn down the gain, adjust my focus. All right, we'll have our patient take in another deep breath, and we're going to finish finish slicing through the right lobe. All the way out to the lateral edge. Getting a little dark here. I'm just going to brighten it up just a little bit. And the tissue is becoming undiagnostic over here, so we're just going to finish off our slicing there. And we'll have our patient breathe. Now at this time, we are going to take our comparison image between the liver and the right kidney. So we're going to come below the right rib cage subcostal, and we'll have our patient taking a deep breath. And we're getting a nice image right here, and we'll freeze it. We're going to kind of tone down our gain a little bit. We'll have our patient breathe. And at this time, we are taking this image because we are going to be comparing the parenchyma of the liver, the echogenicity, to the echogenicity of the sinus of the kidney. So that's that bright central aspect here. And we know that if the liver is matching up closely to the sinus of the kidney, we might have some sort of abnormality such as fatty liver. We are also going to measure the liver at this time, the length of the liver, that is. So we're getting about 14.37. Normal is around 15 to 20 centimeters. All right. Then, just like we did in the sweeps, we are going to go ahead and evaluate the left lobe in the transverse plane now. So we're starting again at midline here, and we're going to have our patient take in a deep breath, and we're going to come far superior so that we see the left hepatic vein come into view here. So that's our first slice, and we're, like I said, very far superior here. We're just going to keep coming down. We're going to see the portal vein come into view, more inferior. We're going to see the ligamentum teres. We're going to cut our depth just a little bit. We increase it 1. And we're going to see the pancreas come into view. And then we're out of the left lobe here. So we'll have our patient breathe. And I just need to change my label here. So now we're on to transverse right lobe. And we're going to do the same thing up here. We're going to start very far superior in the right lobe of the liver, and we're just going to keep coming inferior until we slice all the way through it. So we'll have our patient taking a deep breath. And this dome image up here can be sometimes hard to get with the diaphragm in view down here. You want to make sure we have enough space below just so we can evaluate for fluid collections. We'll freeze it here. And we actually want to make sure no hepatic veins are in view. And we'll have our patient breathe quickly. And then right below the level of the dome, we're going to see the hepatic veins come into view. So we'll have our patient taking another deep breath. And we're going to come down. We're going to increase our depth, like I said, just leaving ourselves some room below, or above, should I say. And then we're going to keep slicing through. We're going to tone down our gain just a little bit. And I'm going to adjust my focus here if I need to. Portal vein. And then we see the kidney. We'll have our patient breathe just to give them a little breather before we continue slicing. We'll have them take another deep breath in. And we're just going to make some adjustments here. I'm kind of coming more subcostal just so I can get the kidney better. And this lateral edge here. So we see the kidney. We're going to decrease our depth. Bring up our focus, decrease our depth again, and finish slicing through the right lobe until it becomes undiagnostic. And we'll have our patient breathe. Now at this time, we are going to evaluate the CVD, and we are going to be measuring it from top to bottom. So the CVD runs right alongside the main portal vein. So we know that when we see the main portal vein, we know that we have to look very closely for the CVD because it is a very small structure. So we'll have our patient taking a deep breath, and we see the portal vein come into view. Ideally, we would like to get the CVD dumping into the head of the pancreas. She's got some gas coming into view here, so we're just gonna try to adjust around that. And we're gonna do our best to elongate this. So, we'll have our patient breathe. Give him a little breather. We'll have him take another deep breath in. And we're getting it right here. I'm gonna just zoom in just a little. And then I'm going to turn on my color because I see it coming into view here. We're gonna freeze it, have our patient breathe. We're gonna take an image of just the color, and we're seeing the CVD here. It's not filling in with color because it is not a vessel. And then we are going to go ahead and measure it top to bottom. And that is it for the liver portion of the exam. Now we will begin the duplex portion of the exam. So to start off the duplex portion, we are first going to evaluate the hepatic veins. And the hepatic veins are important because they drain the liver of all the blood. So we're going to turn on our color, increase our color box size, and we'll have our patient taking a deep breath just to quickly take a look at her hepatic veins. And we see them super nicely right here. So we're just going to freeze and take an image because we've got them nicely filling in with blue. So the blue color usually indicates vein, but not all the time. It just means that the transducer is actually, the blood is flowing away from the transducer. So in this case, this is what we want for the hepatic veins. So we're gonna take an overall color image of both, or not both, all the right hepatic vein, the mid hepatic vein, and the left hepatic vein. We're seeing all three in this image. So after we take that, we're gonna go ahead and Doppler each individual hepatic vein. So we'll have our patient taking a deep breath. And again, we see it coming in super nicely here. We see a lot of color, crazy color coming into view here just because we are so close to the heart. We see the right hepatic vein nicely right here. So I'm going to update. And we're gonna freeze. And just because this particular vein is coming in at kind of a funky angle, we do see some flow above the baseline, but we want to see the flow primarily below the baseline. And this tells us that the hepatic veins are flowing hepatofugally, which is what we want from the hepatic veins. That just means that they are draining the liver, which is exactly what they're supposed to do. And we're also seeing a W waveform here because the hepatic veins are so close to the heart that they cause a pulsatile pattern to appear within the tracing. So now at this time, we are going to evaluate the mid hepatic vein. So we'll have our patient taking a deep breath. And we see the mid hepatic vein coming into view here. We're going to quickly update. And I'm just gonna update again just because I know we can get it a little smoother. We're getting a much nicer W waveform here. And we'll have our patient breathe. It's nice and clear. We can see the pulsatility within the tracing. We're just going to cine back slightly on our color. And I do want to indicate as well that we are still coming from midline here, which is where we captured the hepatic veins while we were doing the full liver scan as well. So for this particular patient, we are seeing the hepatic veins super nicely from the midline subxiphoid position. So at this time, we're also going to take a signal of the left hepatic vein. So we'll have our patient taking a deep breath. And just want to get it a little nicer here. We're seeing a lot of crazy color flow. And again, for the left, we're getting a nice signal here. We'll have our patient breathe. And we'll take an image of that. And then it looks like the right hepatic vein signal did not save. So we're just going to quickly take another image of that, maybe try to clean it up a little bit and retake the image. So we'll have our patient taking another deep breath. I'm just gonna quickly take that. And we see it nicely right here. We're actually getting a much nicer signal on that, so it works out. Have our patient breathe. We're gonna cine back, and we're gonna label this right hepatic vein. And we're still getting the kind of W waveform, pulsatile, continuous signal. So now we're going to turn off our spectral and color, and we're going to try to find the main portal vein here. So at this time we're going to turn back on our color. We're seeing it nicely in grayscale. So we're just going to do our best to elongate it from the hilum into the right lobe here. And I'm just going to increase my color box size. And I'm going to freeze it and take the image, label this main portal vein. We're also going to do a spectral, so we'll have our patient just hold their breath for a moment here so we can get the signal without respiratory interference. We're going to decrease our scale. We're seeing some interference come in here. Have our patient breathe. Just want to make sure that we're not getting this interference, so we're going to kick it over here. We'll take one more signal just to clean that up. And we'll have our patient just hold their breath for a moment here. We're going to take the signal right by the hilum. We'll have them breathe. So we're getting a nice continuous signal here above the baseline, which tells us that this signal is, or the blood in this particular vessel is flowing hepatopedally. The main portal vein is one of the major vessels that supplies the liver with blood. So we just want to make sure that this is flowing in the correct direction and that it's feeding the liver. So it's checking out okay, and it's continuous because obviously the liver is a blood-hungry organ. We want to make sure it's getting the proper blood flow. We are getting a little bit of a signal below the baseline just because of the angle we're coming at. It is pretty horizontal to the sound beam, so perpendicular that is. So we're gonna take our image here, and then we're gonna turn off our color and our Doppler, our spectral, and we're gonna do our best to get a grayscale image of the main portal vein, and we're going to measure that top to bottom. So we're just gonna kind of come around here. I'm just kind of up on almost like the ridge of the right rib cage here, intercostal, and we're gonna maybe come up a rib and try some different positions just so we can see it nicely. We're going to increase our gain just a little bit just to get that a little bit better. We want to make sure the lumen is clear of any echo. tidbit here. Just trying to work with the patient's breath here. All right, I think we got it decent right there. So we're gonna take this and we're gonna measure near the hilum, top to bottom, and 1.02 centimeters, so that's normal. And then we are going to move on to the hepatic artery. So we're going to take a color image of the hepatic artery. The hepatic artery also feeds the liver as well. And it's going to be a small structure running right alongside the liver here. I'm just going to increase my scale just a little. And we're seeing it come into view here. Just gonna try to elongate it a little bit, see if we can get it any better. And I'm gonna freeze it because I see it coming into view right along the main portal vein here. I'm going to take that. And then what we're going to try to do is we're going to try to obtain both the main portal vein signal and the hepatic artery signal in the same spectral tracing. So we are going to increase our sample volume a little bit here, and we'll have our patient just hold her breath. And we're just going to tilt back and forth. We're going to capture the signal. Freeze. And then we're seeing both the hepatic artery signal, so the peaks here we see coming in, then we see the main portal vein just riding along the baseline here. So we're going to take that as our hepatic artery, main portal vein spectral together. I'm still intercostal position here. And then we're going to move on and do a color image and spectral in both the right portal vein and the right portal vein and the left portal vein. So I'm going to turn off my spectral for the time being, and I really want to focus on the area where the main portal vein is branching into the right lobe. So I'm going to try to elongate it the best I can here. Again, working in the rib spaces here. All right, so we've got a nice image here of it. It's branching into the liver here. Take an image. We're going to perform a spectral tracing on it. We're going to decrease our sample volume from the last spectral tracing we took, and we'll have our patient just hold her breath. Try to get it, elongate it, and you can breathe. I'm just going to try to mess around a little bit, try to get it more elongated, and that looks better. So we'll have our patient hold their breath and spectral it. Just bring down our scale just a little. And we'll have them breathe. Again, we want the continuous above the baseline hepatopedal signal here, and that again signals to us that the blood is flowing into the liver. And now we're going to move on to the left portal vein. So we're going to come from midline for this. We're going to turn off our spectral. We'll have our patient take in a deep breath. And we're going to come just below the level of the hepatic veins. I'm going to do my best to elongate this the best that I can. And I'm going to freeze, take an image, and quickly take my signal within the left portal vein. Should be getting the same exact signal as we saw in the right and the main portal vein. So we'll freeze it, Still continuous above the baseline signal. And then at this time, we are going to move on to the superior mesenteric vein. And this is an important structure just because the superior mesenteric vein as well as the splenic vein actually form the portal vein. So we want to just make sure down the road things are looking okay as well. So we'll decrease our depth and seeing it come into view here. I'm going to decrease my depth one more. And getting it right here. I'm at midline again. We're going to have our patient taking a deep breath just to make sure we're at the right structure. Alright, checking out okay. We're going to just decrease our scale a little bit just so we can get some more flow in here. Take an image. Quickly take a spectral. And then I'll have our patient breathe. So we're getting this at kind of a funky angle again, so we are getting some flow above the baseline here. But the signal we're looking for is below the baseline. We want to see that it's continuous. And then we'll move on to the IVC. The IVC is obviously important because the portal or the hepatic veins dump into the IVC. So we're coming from midline again. We'll have our patient taking a deep breath. We're going to increase our depth here. And we'll come into the sagittal plane. And getting it nicely here. I'm going to increase my scale just so we're not getting so much aliasing. We'll freeze. And then we'll take a quick signal. Freeze again. You want to see the below the baseline pulsatile signal for the IVC just because it is very close to the heart again, causes the pulsatility within the signal. And then the last but not least vessel that we are going to evaluate, as stated before, the splenic vein and the SMV form the portal vein. So we are going to check out the splenic vein. We'll have our patient roll up on their right side, making some adjustments to maintain our ergonomics at this time. And then we are going to capture the splenic vein. So we're going to adjust our box. All right, and we're seeing splenic vein come into view here super nicely. So you see it coming down below. And again, we're going to take a color image as well as a spectral. So we'll have our patient, as soon as we get it into view, we're just going to have them, I'm just going to increase my color scale, or my color gain, should I say, just a little bit. So we'll have our patient hold their breath. We want to make sure we're taking the signal outside of the spleen. And we've kind of got quite a big spectral tracing here, so I just increased my gain just a little bit just to make it appear not so large, so it's appropriate. And then we're going to take an image of our signal, and then that is it.